Hi, my name is McCabe. This is the Assessment of Human Performance, Health Screening, Assignment 1. There's 4 methods of health screening. Number 1 is a physical activity readiness questionnaire, also known as a PARQ. It is 7 questions. It is a self-screening tool used by anyone who is about to start an exercise program. A PARQ is mainly used by fitness instructors and coaching staff. It determines safety and possible risk of exercise for an individual based on their answers to specific health history questions. A PARQ is used to identify anyone whom physical activity is inappropriate for and anyone who needs to seek medical advice to find out the most suitable activity for them to start any physical activity. Number 2 is health history questionnaire, also known as a AOHP, is required to be filled at the start of the first appointment. It looks at the personal and family history for signs and symptoms of disease. It's a more in-depth questionnaire. It looks into people's personal lifestyle management, like smoking and drinking, and how much exercise they actually do. And it assesses the intensity of an exercise someone could do. Number 3 is informed consent. Gives someone information about the process of what they're going to be doing. It includes a detailed description of the program, the risks and benefits of the program, a confidentiality clause, responsibilities of the participant, and a documentation of acknowledgement. It should be conveyed verbally and written so that the person knows and understands the risks and circumstances associated with what they're going to be doing. AOHP and informed consent are similar because they both need a signature, both personal information, both need parents' consent till 16, and are both structured. AOHP is different because it's a questionnaire, asks for information, it finds out risks, but it never changes. Informed consent differences form. It's similar for each person, highlights risk, and changes for what it is. PARQ and informed consent are both similar because they're personal information, parents' consent for under 16, both structured. PARQ's differences are, it never changes, it's a questionnaire, finds out risk, it's different answers for each person, so everyone's not going to give the actual same answers. And informed consent is different because its form is similar for each person, it changes for what it is, and it highlights risks. PARQ and AOHP are very similar because both questionnaires, both don't change, both have personal information, both find out risks, both are structured, and both are different answers for each person. So again, no one's going to give the same answers. AOHP is more in-depth questions, so it goes more into lifestyle management and more into about smoking, and about how much alcohol, and more into family history. There's no limit of questions, whereas PARQ only has 7 questions, plus medical referral if needed. Health monitoring tests. There are 4 main types of health monitoring tests: rest and heart rate, peak flow, waist to hip, blood pressure. Resting heart rate. A normal resting heart rate is anywhere from 40 to 100 beats per minute. A resting heart rate can vary within your fitness levels. If you're more fitter, your resting heart rate will be lower because your heart will be bigger. You should take a few minutes before waking up, give your body a few minutes to adjust to waking up. If you can't do it while waking up, you should lie down for 10 minutes. And the best ways to take it is in your wrist and in your neck. Disadvantages are if a less practiced practitioner does a resting heart rate test and doesn't use the 2 fingers and uses the thumb, there's also a pulse in the thumb. Blood pressure. Blood pressure measurements are important because they are highly related to heart disease risks. Normal blood pressure usually considered to be 120 for systolic and 80 for diastolic pressure, same for both men and women. Medical treatment should be sought after if measurements are in the high category consistently. Advantages are there's no accuracy problems because a machine is used to take blood pressure. How to conduct a blood pressure test. It should be in a quiet place. You should rest for 5 to 10 minutes. You should roll up your sleeves so nothing's in the way. Sit up straight with legs crossed, uncrossed, so it doesn't restrict the blood flow. Rest your arm on a table. Secure the cuff, blood pressure monitor. Inflate the cuff, deflate the cuff, and then record the time, the date, the time, and the systolic and diastolic pressures. Peak flow. Peak flow is used as an indicator for asthma or something similar. It's a small pocket-sized machine. Advantages are it's small and portable and inexpensive. disadvantages are a peak flow is not as accurate as other lung functioning tests. How to conduct a peak flow: you stand up straight, make sure you have no gum or food in your mouth, and you put mouthpiece on the peak flow. Put your gauge to 0, blow as hard as possible, record the value of the gauge, and repeat at least 3 times and take the highest recorded. Waist to hip. Waist to hip is to find the location and quantity of the fat in an individual. Advantage is only 2 measurements taken, so less chance of error. It's low cost and it's easy to just self-testing, so you can do it yourself. Disadvantages may not be accurate in those with thick waists or those that are particularly tall or short, and it might not be accurate in women. How to conduct a waist hip: you stand up straight, measure the hip at the narrowest point and the hips at the widest point. The waist circumference is measured midway between the lower rib margin and the iliac crest. Hip circumference is measured at the point near the maximum circumference over the buttocks. Divide the waist by the hip measurements. Health screening questionnaire. 2 participants. Participant A was Chris Hunter, age 24, height 181 centimetres, weight 96 kilograms. He's a cheerleader, he does 20 hours a week, but it's mostly coaching. And participant B, Joanne Matthews, age 38, height 167 centimetres, weight 60 kilograms, and she does exercise and fitness and goes to the gym regularly. This is Chris Hunter's questionnaire. And this is Joanne Matthews' questionnaire. Participant A and Participant B both answered no to all 7 questions of the PARQ. Participant A and Participant B both live moderately healthy lifestyles. Neither of them smoke or consume alcohol more than 3 times a week. They both also do more than the required ACM guidelines of recommends of 150 minutes of moderate intense exercise a week. Participant A and Participant B answered the rest of the questionnaire very similar until the questions on family history. Participant B had no relatives who had had cardiovascular disease, whereas Participant A did have relatives who have had cardiovascular disease. The ACM states that risk factors for cardiovascular disease can be improved through simple lifestyle changes. You can do this by having a regular exercise program. Furthermore, a balanced diet rich in fruits, vegetables, lean protein and fibre will reduce your cardiovascular risk. Also, regular visits to the physician. Participant A exercises daily but has not had a physical examination in 12 months. Applicant A needs to see a physician more regularly to discuss the problems, and he also needs to have a balanced diet.
Okay.